Hey, honey. All right, here we go live. It's February 5th today, 2019. And Jesus here had surgery just last night for his appendix. He's 12 years old. He just turned 12 in just a few months ago in November. And so he presented to me on Friday after school that his stomach, the lower part of his belly was hurting underneath his belly button. Do you remember? Is that what you were complaining of? Your belly? It was underneath your belly. It was kind of hurting, right? And it was kind of like off to the left in the middle. So we kind of thought it was your stomach. We thought it was food poisoning. We were kind of hoping it was food poisoning. Unfortunately, we were hoping for that just because that's the um, less, you didn't have to come to the hospital and stuff. If you had food poisoning, then it would have been less invasive. But I'm glad we did come to the hospital and check it out because, we did wait over the weekend in hopes that it was food poisoning. Then we were thinking that maybe it was the H1 or the flu, one of the flus. So anyhow, do you remember? Were you sick? Did you feel sick? You felt nauseous. You threw up, right? You can't speak right now either, right? It's hard for him to speak because he has this tube that's going into his nose, and that's called an NG tube, a nasal gastric tube, and that's just to pull out any mucus that might be accumulating in his stomach so he doesn't, end up like throwing that up or vomiting it out, and then it goes into his lungs and he like suffocates. So that's what that tube is for, to prevent any suffocation off of throwing up, which is also called aspiration, to prevent that. And so he wasn't getting any mucus, and we were concerned about that last night. So they put in a mucus tube, and now he's gathering some mucus here, which is good. They even did an x-ray last night. They came in and they did an x-ray on him around 4, or actually this morning around 4 o'clock. He's had, did you have an IV on that side too? No, they just took blood. They took blood early yesterday to, figure out the tests and whatnot. He's got an IV here. That's his second IV. They took it out. He had an IV right there. Ooh, did you even feel that? Were you here when they took that out? No? Oh, that's nice. They did it while we were sleeping. And right now he says his pain is at a what? 4, you said? Like a 4? Okay. He can't really speak because that tube goes all the way down through his throat, all the way down into his belly. And so it makes it really hard for him to talk. So he's just trying to nod his head and use his hands. So this is a Emmy bag in case he needed to throw up, because he did throw up at home. He had bouts of diarrhea, so that's why we were thinking it was food poisoning, because it kind of presented like it was food poisoning. He said the pain was coming and going, and he had diarrhea and he was nauseous, and it just sounded like food poisoning, and that would have been easier if it was food poisoning, but that's not what happened. So anyhow, they explained to him that he would be here for a few days. They had explained to us that we were going to be here for a few days, and they were gonna start him off on some antibiotics, because when we got here, I had mentioned to them that he ate a half of a big bag of Takis, and maybe that upset his stomach, and they said that wasn't it, because He ate that on Thursday, and then Friday, almost 24 hours later, is when he started feeling sick. So they assured me, they said that it wasn't because of the talkies, that this had been accumulating over time, and it's just his appendix. So they, and I know I've researched before, and I know about the appendix, not too much, but I know enough that it's just a little appendage um, off of your the ending of the small intestines, beginning of the large intestines, and it just like sticks out and hangs out, and sometimes it gets clogged up, and it'll get backed up, and in that case it'll cause you discomfort, and hopefully it doesn't rupture, and then you can just have it removed. In this case, he hasn't ever complained about his tummy hurting or being upset or anything. It was just something that was just a quick onset. It just happened Friday, and then it just got worse over the weekend. Saturday, he was hunched over. Sunday, he said, is when he felt really extreme pain, the worst pain, he says. And then by Monday, I told him, we'll see if you can get up in the morning. If you can't, then we'll call the doctor. And he got up, but he was like hunched over, like really bad, hunched over in pain. And he was hunched over in pain on Saturday also, but on Sunday, you could tell like he lost color, that he wasn't doing well. So I called the doctor right away, made an appointment. We were supposed to be there at 10:45, but right before, when we were getting ready to go, he had to use the restroom again. He was feeling sick, and he was in there for a while. And so I called the doctor's office to tell him that we were going to be late, if that was okay. And they said that the doctor wouldn't be able to see him, and they don't have any other openings to that day, yesterday, and if we wanted to reschedule. And I told her, oh no, my son's been sick over the whole weekend. Like I can't. No, I think the best bet, if you guys can't see us, I'll just take him to the emergency room. And she said, okay, well, where did you say his pain was? And then I had asked him at the time, because it kept changing, kind of where his pain was. And then he said it was kind of like all around his belly, because they asked which side was it, and at first it was like more to the left, where his stomach area is, and that's why we were hoping it was food poisoning or the flu or something. But then he said it was all of his tummy. So then the doctor's office, the lady I spoke to, the rep, she said, it kind of sounds like it could be something else. Like, maybe, I hope it's not appendicitis. And right away I was thinking, oh my gosh, appendicitis. I hope it's not that. I was like, I hope it's just food poisoning, or the flu bug, or just a really upset stomach because he ate spicy, and he's not really used to eating that much spicy foods. So that's kind of what I thought it was, and I was hoping that it was that. They came and they did the flu swab, and they checked it right away, and it was negative.